Evan here from my lab. Today we're talking everything TMJ. Now specifically we're going to be talking about stretches, strengthening, and some releases as well. Why are we doing this? Well, in this day and age there's a lot of people with a lot of stress in their life, and when we stress, oftentimes we clench. So this can also relate to headaches, neck pain, discomforts around those areas. So it's important to make sure we take a look at our jaw. Often a spot that we don't even think about. We really neglect it with how much we use it from talking, eating, yawning. So let's get right into it. First off, let's talk about ranges of motion. We want to first test ourselves out, and I should note, most of this is really best done in front of a mirror. You don't need a partner for this, just yourself in a mirror, taking a look, and you should be able to see the asymmetry side to side. At the end of the day, we want symmetry. If you are real close, like within 5% of symmetry side to side, chances are much less likely that you're going to have any injury or pain. So let's first focus on symmetry. For this, the primary ranges we're going to be talking about: opening, closing, clenching together, lateral movements to the side. This is where you lightly open your jaw and move it to the side. Protraction, shooting your jaw forward, and retraction, bringing it backwards. Now, when we feel like we need to improve some of these ranges of motion, a nice simple first gesture here is to apply a light overpressure. So I'll show you that in each of these ranges. First off, if we want to improve protraction, a great way to do that is put our thumbs on the back of the angle of the jaw, protract forward, so try your best to shoot the bottom of your jaw forward, and then apply a little bit of a pressure from your thumbs to assist you. If we want to go into a retraction, that's backwards, put your hand on top of the bottom part there of your jaw, your chin, hand on the back of the head, and push the jaw slightly backwards into a neutral position. How about increasing our opening? Well, this one can be done simply by putting your fingers into your mouth and applying a bit of an overpressure. Conversely, you can also grab onto your chin, open your jaw, and lightly pull down as well. If you have troubles with clenching, hold on to the bottom and help yourself come up gently. If you're ever doing this and it gets into a sharp, painful spot, you may actually be entrapping the disc or pinching on some muscles, nerves, or tendons. So make sure you reduce that range first, and if you can't get out of pain, contact your primary healthcare provider. If we're going to lateral movements, to your right side for example, apply that nice light overpressure while you support the top part of your head. And then to the other side. What about if just right off the bat, almost every part of your jaw feels too tight? A simple trick here, press the tip of your tongue to the roof of your mouth as hard as you possibly can. Cool little trick, because when you do that as hard as you can, it's actually biomechanically impossible to clench through your jaw. A real simple starter point for this one: every time you're driving, you're at a red light, press the tip of your tongue to the roof of your mouth, give yourself that little bit of a reprieve, because all of us could benefit from reducing our jaw tension. But especially if you're acute, tip of your tongue, roof of your mouth as hard as you can. Next, we want to make sure that we are able to control our opening. So this means we want to keep it in alignment. Common issues with TMJ jaw dysfunction is that tracking issue where the jaw goes to one side or the other, causing clicking or pain. So to do this, let's stick the tip of your tongue to the roof of your mouth just behind your teeth and slowly open as wide as you possibly can. I'll demonstrate. Now you can also do this with a bit of a guide, literally in front of a mirror, making sure that you don't translate and push out on either hand by opening your mouth. If you have a click or a deviation, you're likely to feel one side of that jaw poking out one way or another. Just lightly guide it back into a nice neutral position. A third trick for this one, put a toothpick, one on the top row and one on the bottom row between your front teeth, and in front of a mirror, open up your mouth to make sure they are aligned as much as possible. Imagine it was drawing a line between those two as you open, and you want to keep that as straight as possible. A nice slow motion as you open and close. Now let's talk about some strengthening, so that way you've already got the great range of motion, we can keep it that way in a nice healthy manner. For strengthening the jaw, we're going to do isometric exercises. That means the muscles themselves are activating while the joints are not moving. We're going to keep the mouth about 1 finger width open and keep that tip of your tongue to the roof of your mouth. As we do these exercises, make sure you don't flare anything up. Don't push too hard, of course, but get a nice burn through these muscles. So if I want to increase my muscular endurance and strength to the right side, this is how I'm going to do that. If I was going to go to the left side, same thing with protraction. Can't do it with retraction, so you're forgiven on that one. And then also you can do a very similar thing with opening and closing. Opening, bottom of the jaw. Closing, don't bite yourself here, be careful of course. You could either put something in between the row of teeth or you can just go ahead and support your jaw so you can't close as easily. For each of these exercises, we're going to be going for a 10-second hold, 5 reps, at least twice a day. Other things to note here, to do some light self-releases, you can put a little bit of lotion on your thumb, work just behind the angle of your jaw, kind of towards your throat, pressing your thumb towards the bony part there, that angle of the jaw, and just lightly do some muscle stripping. If you go a little bit more towards your throat, you're going to be around some lymph nodes and some glands. That's okay, it just might cause a little bit of irritation, so let's just stay as close as we can to the angle of the jaw or the mandible there. Now work on that until the discomfort reduces by half, which most studies show it's about 3 to 5 minutes. You can do the same thing on the outside part of the jaw muscles and also the temporalis tendons up top here. All very intimately related to jaw discomfort. If your discomfort persists, be sure to check in with your healthcare provider as they may be able to provide some manual therapy options. Another great resource is to look into something called an aqualizer. An aqualizer is a temporary night splint that relieves the discomfort of your clenching as it allows essentially water to travel through a canal and create a nice little cushion on your jaw. We do provide those at MyoLab, and if you have any more questions, be sure to contact us. Now, another common thing that we need to discuss is what should you avoid while you're going through TMJ dysfunction or pain? Well, avoid big yawns. So when you're yawning, press the tip of your tongue to the roof of your mouth. You can't overextend it. Another thing you can do is beware of tough foods. You know, the classic big apple bite or chewing into a hard, firm piece of steak or just hard food in general. Be cognizant of that, especially when you're yawning, talking, chewing. Another one that people commonly forget is when you're laying on your side, watching TV, sleeping, reading a book, try to not rest your head right on your hand, affecting that jaw into some lateral movements. That can really jam it up as well. Any questions still? Great, leave us a comment below. Message us on Instagram or email us at info@myolab.ca.